been just over a week since ABC7 showed you this first-of-its-kind virtual reality rendering that shows the damage COVID-19 can do to the body.
Everything in that video that was yellow that we saw was a combination of infection and inflammation.
As for the actual patient whose lungs are depicted in this video, it's a man in his late 50s, and Dr. Keith Mortman shared a sad update on Wednesday.
Unfortunately, like far too many other patients that we're starting to see, he did succumb to his disease.
For Dr. Mortman, the loss hits home because as the chief of thoracic surgery at George Washington University Hospital, he was able to use that patient's CAT scan to create these eye-opening images that have now been seen all over the world.
The main goal of doing it, to educate people about the need for social distancing and washing your hand and proper hygiene and why we have to stay 6 feet apart.
Then shortly after the patient's death, we've learned his wife reached back out to Dr. Mortman.
It actually brought me to tears to read her email. She started by thanking us and how appreciative, she is, and how much her husband would have appreciated, getting the message out.
A message of vigilance, and for that grieving widow,
it's touching.
A legacy that will live on each time these images are shared.
And she's a huge part of this, and we could not have done this without, her permission to share that initial CAT scan.
Such an important message, and Heather joins us live now at the Alert Desk tonight. Heather, did Dr. Mortman say whether that lung damage could be permanent in COVID-19 patients who survive?
Well, Michelle, Dr. Mortman said he believes a patient who's experienced relatively mild symptoms likely won't have that long-term damage to their lungs. As for patients that end up in the ICU or on a ventilator, he does expect some degree of permanent damage. But there are still so many unknowns about the virus. It's important to point out the full extent of its lasting impacts aren't yet known. Michelle, back to you.